Hi, Assalamualaikum. Let me introduce myself. My name is Nur Umairah binti Muhammad Tamizi. My metric number is 2013325007. I am from Bachelor of Civil Engineering Technologies in Construction. Now, I will be passed to my group members to introduce themselves.
Hi, my name is Noshana binti Saleh. My matrix number is 2014-71782. I am from Bachelor of Food Technology.
Hi, Assalamualaikum. I'm Raishiki binti Syarul Anwar. My metric number is 201332035 and I'm from Bachelor of Civil Engineering in Technology in Construction.
Today, we will talk about the importance of wearing face masks during the pandemic COVID-19. Good morning, ladies and gentlemen. I am Shahnaz and you are watching the Bulletin of Current Issue. Today, we will be talking about the importance of wearing face masks during the pandemic COVID-19. To get a better understanding about this event, we will talk with Dr. Umairah, who is a Ministry of Health. Not forgetting, we also have another guest, the general public, Ms. Nur Ashikin. COVID-19 is a novel virus that has not been previously identified. We are still learning on how it spreads, the severity of illness it causes, and to what extent it may spread throughout the world. We are going to start with Dr. Umairah. What the importance of wearing face mask in a general public, doctor? Can you tell us about that?
Yes, I can tell us about that. The first one is, in area where the virus is circulating, masks should be worn when you are in a crowded setting where you can be at least 1 meter from others, and also in the room with poor or ventilation. It's not always easy to determine the quality of ventilation, which depends on the rate of air change, circulation, and the outdoor fresh air. So, if you have any dog, it's safer to simplify wear a mask. Second, you should always clean your hand before and after using a mask, and also before touching it while wearing it. The third one is, while wearing a mask, you should still keep physical distancing from others as much as possible. In addition, wearing a mask does not mean you can have close contact with other people.
Nur Ashikin, do you have any question you want to ask the doctor?
Yes, thank you, Shahnaz. Doctor, can you share with us what is the difference between medical masks and respirators like N95?
Yes. The difference between medical mask and respirator is, medical mask, also known as a surgical mask, they have four characteristics, which is, the first one is composed of three layers of synthetic non-woven material, configured to have filtration layers sandwiched in the middle, available in different thickness, and lastly, the various level of fluid resistance and filtration. While respirator, also known as a filtering face piece respirator, as known as FFP, are available at different performance levels such as FFP2, FFP3, N95 and N99.
Is it okay to wear respirators mask, doctor? I mean, in terms of protection.
Medical mask and respirator mask are the similar in the protection value. However, respirator are specific to certain procedure and instance because they have a tightly fitted component to them. Respirator masks are designed to protect healthcare workers who provide care to COVID-19 patients in setting an area where aerosol generating procedures are undertaken. Healthcare workers should be fit test before using a respirator to ensure that they are wearing the correct size. Wearing a loosing fitting respirator will not offer the same protection to the wearer and may allow some particle to get inside the mask through the side.
Does WHO recommended the use of mask in exhalation valve to prevent transmission of COVID-19?
No, WHO does not advise using mask or respirator with exhalation valve. These masks are intended for industrial workers to prevent dust and particles from being breathed in as the valve close on inhale. However, the valve open on exhale, making it easier to breathe but also allowing any virus to pass through the valve opening. This makes the mask ineffective at preventing the spread of COVID-19 or any other respiratory virus.
Doctor, now there are various types of masks including fabric masks. Whether fabric masks can be worn to replace medical masks?
Fabric masks are recommended for people without respiratory illness symptoms who live in areas where COVID-19 infection is widespread, where social distancing is difficult. The WHO defines fabric mask as having one inner layer of water-absorbent material and two outer layers of non-water-absorbent material.
It doesn't matter if decorative or not, as long as the cloth masks are made of the right material. Right, doctor?
Yes, correct. The selection of material is an essential first step as filtration and breathability vary depending on the fabric. It has to be washed daily when used, hence it is best to have at least two masks. Norashikin, I want to ask you something. Did you know the simple step when you are coughing or sneezing in the crowded area?
Oh yeah, I know the simple step to cough or let people away, when in crowded place. Guys, don't forget to do the simple step to help to spread the COVID-19. When you want to cough or sneeze, just cough or sneeze in your arm or use a tissue, and don't forget to throw the tissue in the dustbin. Lastly, the important one is don't forget to wash your hands. When you have a symptom, don't forget to see a doctor. Guys out there, please stay safe and stay home. Don't forget to wear your face mask. And thank you, Karnaina.
So I think we are at the end of the talk. From the top, people are compulsory to wear a mask because it can decrease the possibility to be infected by the virus. So people will be more cautious, concerned about their interaction with the others. Thanks to the panelists who jointly debated the current issue question. I hope a little bit of info that has been presented can provide awareness and initial steps in combating the spread of the COVID epidemic 19. Remember, we take care of ourselves, keep distance, stay at home, come out when necessary. Bye. Thank you, Doctor. Thank you, Ms. Nur Ashikin.
Most welcome.
Thank you, Doctor and Miss Shanas. Nice to meet both of you.